Hello, and welcome to the Mobil-Aider Arthrometer. It is my pleasure to be part of this product showcase.
Over 6.5 million joint injuries occur each year, needing accurate assessments. Orthopedics is about precision, yet our clinical tests have a large subjective element. Manually assessing millimeters of joint movement with our hands can be challenging and inconsistent, leaving room for error. What if you had a device to provide objective data about the magnitude of an injury? A device that is validated, portable, versatile, affordable, and can drive incremental revenue to your practice in the tens of thousands of dollars each year without any extra work. Meet the Mobil-Aider Arthrometer. Our innovative state-of-the-art device enhances your professional skills while objectively measuring joint mobility with up to 95% accuracy. The ergonomically designed Mobil-Aider Arthrometer weighs just 14 ounces with 7 custom contoured attachments, so you can take it wherever you go, comfortably performing more than 14 techniques across 5 joints: knee, ankle, shoulder, elbow, and wrist. You get immediate objective data by merely putting the device between your hands and the patient. The motions are simple because they're similar to what you already perform. The real-time visual feedback helps you explain to your patient what your assessment means, while allowing you compensation from the insurance provider. The result? Extra revenue through a 97750 reimbursement code, averaging $35 per use without any extra work. Your return on investment can be as little as a few weeks, with the ability to generate close to $30,000 per year, doing 3 assessments a day. Say goodbye to guessing. Get objective, accurate data to guide your treatment and increase revenue for the clinical tasks you're already doing. Orthopedics is about precision. Patients demand it. The Mobil-Aider provides it. Learn more about improving patient assessment and increasing revenue with the Mobil-Aider today.
Hello, my name is Dr. Dawn Gulick, and I am so thrilled to be here. I've been a clinician in the clinical space for decades. I've been an academic. I've published books, but this recent journey as an entrepreneur has been so exciting. I've been fortunate enough to get over $1.2 million in National Science Foundation grant funding to develop the Mobil-Aider device. So as clinicians, you know the problems with manual therapy. Joint assessment is subjective. There's very poor clinical agreement. Techniques are skill dependent, and objective feedback is critical. If we inaccurately interpret a diagnosis, we can render inappropriate treatment. As a matter of fact, misdiagnosis of acute ACL injuries for ER physicians is as high as 74%. The current practice out there, there's arthrometers out there, but they're made for the lab, right? They're really not portable. None of these devices lend themselves to being used in a clinical setting, let alone on the field. The only device that did that was the KT1000, but it was a one-trick pony. It could only be used for the knee, and it was never actually validated. And it's kind of a moot point now because it's off the market. So we set out to solve this pain point with a device that could be portable, affordable, versatile, right? And give us objective data. The Mobil-Aider is that device. And we are now patent issued, FDA cleared. As a clinician, you want to know, what are my options here? Well, there's a deluxe device that has 7 attachments. It can be used for 5 joints across 14 motions. Comes with this counter docking station with a built-in charger base, and it's priced well below all current arthrometers on the market. If you tend to specialize in one joint, or you want to have a device to go out on the field with you, you can purchase the custom kits in these handsome portable devices, right? The portable cases, go out on the field. So we have the knee, the ankle, the shoulder, and it comes with the pieces that are just for those joints. So they are specific, right? So let's take a look at the knee device. How does it actually work? This is our unboxing video. You can see the custom dovetailed devices with the snap-in plungers. You put the pieces on, you fire up the device, and then you simply put it on the patient and do the same technique you always do, right? The gold standard, a Lockman's test. You line it up at the joint line, and you translate, and you get immediate visual feedback of exactly how many millimeters of motion that joint translates. And then you compare to the other side. It's that simple, guys, that simple. How about the shoulder?
Okay. Orthopedics is about precision. We should be able to measure joint mobility and quantify that movement. The Mobil-Aider Arthrometer allows us to do that. Allow me to demonstrate for the shoulder. By placing the device on the shoulder, aligning the joint line, we can simply do a posterior glide of the shoulder and immediately get a real-time value of exactly what that translation is. I can flip the person over and do an anterior glide as well. We can also line up from superiorly and do an inferior glide. All this gives us immediate values, exactly of what the measurement was on those mobilization techniques.
How about for the ankle?
It's always troubled me that clinicians wiggle a joint to determine its integrity. Until now, there hasn't been a device out there to quantify joint laxity. I'd like to introduce you to the Mobil-Aider Arthrometer and show you how we can use it to test the ankle. So by lining up the joint line with the device, we simply translate the distal segment of the talus and the calcaneus on the tibia. We immediately get a digital readout of exactly how much anterior translation there was. In other words, replicating the gold standard of testing with the anterior jaw for the anterior talofibular ligament. It's that simple.
So I can imagine now you're thinking, so where's your research? I love when people ask me that question because we have amassed more than a dozen research studies in the past 3 years. And these have been done at reputable institutions. All right. So what did we do? We started by testing the Mobil-Aider to identify validity. We used the smart zoom, and you can see here from this graph, right, the scatter plot, that there was a 0.986 correlation between the Mobil-Aider measurements of linear translation and the smart zoom. Okay, so we thought we're onto something here, right? Then we went and we took it to a radiograph, and we measured the anterior translation of the tibia on the femur. We got 6.96 millimeters measurements or translation on the radiograph. We got 7.1 millimeters with the Mobil-Aider. That's a difference of only 2%. So we're getting really confident here, right, as we're working on these developments of the device, that we're able to measure this. And then we set this up with a study that was done at Mary Baldwin University, and they assessed this with an electromagnetic motion analysis device. And again, our scatter plot shows how the numbers are clustered very close together, and showing us that the Mobil-Aider is valid and it's measuring clinically exactly what we want it to measure. We take that one step further and we take it into pathology. Here's a study that we did with Dr. Summer Hamoud from Rothman Institute. And we found that there was very little difference between the uninjured, athlete side. They're pretty symmetrical right to left. But when we get to a level of an ACL injury, we found 2 millimeters difference in MRIs that showed a partial thickness tear and 3.38 millimeters difference with a complete tear. I don't doubt for a minute that you guys can pick up complete tears because the end feel is very different, right? You get that empty end field, you get that bogginess at the end where it just feels sloppy loose. But those partial thickness tears, they're the challenging ones. And that's what we need objective data for. Regardless of how good you think your manual skills are, I would challenge you to say, can you really tell the difference of 1 to 2 millimeters with your hands? This was an infographic that was published in Sport Health, looking at assessing anterior draws or ankle laxity, right? And this was then published in Sport and Ankle Specialists. And here again, no difference side to side in the uninjured population. But when we get to a grade 1 ankle sprain, a 1.11 millimeter difference, and a grade 2 ankle sprain, 2.16 millimeters difference. Folks, this is a difference between an air cast and a boot, right? We need to be able to treat our patients appropriately based on our assessment, and our assessment needs to be objective. The Mobil-Aider can do that for you. This was a recent study that has just been approved for publication, looking at assessing translation of the ankle with ankle braces. So basically validating that the ankle braces are doing their job. So this is just another way that we can use the Mobil-Aider. And so for those of you that are athletic trainers and you may not be able to get compensation for your device compensation for the device with respect to a 97750 code, you can certainly still use the Mobil-Aider to help your athletes. It may be to obtain objective data on the level or magnitude of injury, but it can also be used to assess the instability of a joint, to provide justification for them to have insurance companies pay for a brace that they might need. So reimbursement, right? Using the Mobil-Aider to get reimbursement for a brace that can help them stay on the field. So orthopedics is about precision. As we stated, patients demand this, and the Mobil-Aider provides it. So as our special gift to you for taking the time out to improve your knowledge and enhance your patient experiences, we'd like to offer special pricing of the Mobil-Aider, 25% off. The deluxe kit would now be reduced to $14.75 and the custom kits to $13.50. And we'll even throw in free shipping for you. So thank you very much. I appreciate your opportunity to share my device with you. If you have any further questions, please reach out to me either by visiting the email address here or visiting our website. Thank you again for this opportunity. Bye now.